Is it time for a blast from the past? Hello everybody, it's Mike from Vox Political here, and it's a year since I asked this question, and it's worth asking again. Does the UK still have a labour shortage because the Tories killed so many of us? My article last year quoted the excellent Prem Sikka in a House of Lords debate after the then Conservative government said it was not happy because there were not enough working age people in the UK to fill job vacancies. I wrote, it would be easy to blame Brexit for the shortfall, and there is certainly an argument that sending migrant workers back to their own countries has been a bad idea. But there's also the fact mark you, that the Conservative governments of 2010 onwards have been killing off working age people at an astonishing rate. This is not a reference to COVID, but to actual premeditated Tory policy. The ever-excellent Prem Sikka made this point in a House of Lords debate on the subject.
With never-ending austerity, millions are struggling to get access to good food, housing, education, clothing, upgrading of skills and healthcare. Deprived people cannot work long hours or fulfill their potential. More workers report sick and have mental health problems, as has already been said by other speakers. So higher disposable income and good public services are key requirements for maintaining and expanding the labour supply. But the government's actually done the opposite. It has cut real wages and access to healthcare. Some 6.3 million people in England are waiting for 7.6 million hospital appointments. That is 1 in 9 persons. Around 2.8 million people are chronically ill and unable to work. More than 500,000 under 35s in the UK are out of work due to long-term illness. An August 2023 study by The Times reported that in 5 years to 2022, some 1.5 million people in England died whilst waiting for a hospital appointment. That is 300,000 a year. A 2022 study published in the Journal of Epidemiology and Community Health reported that between 2012 and 2019, government-imposed austerity caused 335,000 excess deaths in England and Scotland. That is nearly 48,000 a year. 1/3 of these deaths were for the people under the age of 65. The government's obsession with austerity, wage cuts, and defunct economic theories has turned the state into a debilitating and killing machine and is a major cause of the labour shortages that we are actually experiencing.
He said people in secure and well-paid jobs are more likely to have a longer life expectancy and take less time off work due to sickness. This can swell the size of the workforce, but the government has pushed real wage cuts with claims that wage increases for workers are inflationary, though that logic is suspended for executives and bankers. The average real wage has remained mostly unchanged since 2007. The annual UK median wage is around £29,669. This is last year, remember. The Joseph Rowntree Foundation estimates that a single person needs to earn £29,500 a year to reach a minimum acceptable standard of living. A couple with 2 children need to earn £50,000 between them. This means that nearly half the working population does not reach the minimum standard of living, though low incomes can be supplemented by means-tested social security systems. 17.8 million adults have income of less than £12,570. Indeed, due to low pay, more people in work are claiming social security benefits than those out of work. The result is that some 14.4 million people live in poverty. Millions of people are deprived of good food, housing, education, clothing, skills, and healthcare. Deprived people cannot work long hours or fulfill their potential. More workers report sick and have mental and physical health problems. More than 800,000 patients were admitted to hospital with malnutrition and nutritional deficiencies last year, that would be the year before last. Some 16 million people have disabilities, which may affect their participation in labour markets. The government is considering withdrawing benefits from the old, sick and disabled and force them to work, but it is hard to see how that will deal with systemic problems. Rather than improving healthcare, the government has reduced access to healthcare. People struggle to get access to NHS dentists and family doctors. Some 6.39 million individuals in England alone are waiting for 7.6 million hospital appointments. That is 1 in 9 persons. Around 2.8 million people, roughly equivalent to the populations of Bournemouth, Cardiff, Coventry, Edinburgh, Stoke-on-Trent and Middlesbrough combined, are suffering from chronic health conditions and are unable to work. More than 500,000 under 35s in the prime of their life are out of work due to long-term illness. A 2023 study reported in the 5 years to 2022, nearly 1.5 million people in England died whilst waiting for an NHS hospital appointment. That is nearly 300,000 a year. A 2022 study reported that between 2012 and 2019, government-imposed austerity caused 335,000 excess deaths in England and Scotland, i.e. nearly 48,000 a year. 1/3 of these deaths were among people under 65. Another study estimated that between 2011 and 2020, 1.2 million people in England died prematurely from a combination of poverty, austerity, and COVID. The government's obsession with austerity, wage cuts, and defunct economic theories has turned the state into a killing machine and is a major cause of labour shortages. The article is well worth reading as it covers other reasons for the labour shortage, all of which are down to government policy, inactivity, or incompetence. I have been warning that government policy kills since I founded Vox Political in 2011, but at successive elections up until last year, the Tories had been voted back in. So the logical conclusion was that the people of the UK were happy to be deprived of the healthcare to which we all contribute via our taxes, happy to be starved of food, housing and education, and happy to be driven into mental illness by the stress that all this causes. Are we? Or have we all been misled, time and again, by politicians with undeclared interests in keeping us down, along with their client media? With a general election coming up, I said, wasn't it time we gave up listening to the public relations people and started to check for ourselves what we were really being offered? My question now, after more than 6 months of Labour government, and it's a genuine question because I haven't researched this yet, having only just unearthed the article, is this: has the situation improved at all? All right, that's what I've got for you today. Thank you for listening, and if you've enjoyed it, please like, comment and subscribe, and you can see me in the next one.